Hi, it's Dr. Ken here from Spinal and Sports Care Clinic here in the Valley, right between Pines and McDonald, right across from the Yokes. Today we're talking a little bit more about TMJ problems. A lot of people have TMJ problems, so just a quick overview of the problem, who gets it, and then I'm going to cover just a little bit of what we do to treat TMJ problems. So most of the time, guys to gals, gals are more likely to have a TMJ problem than guys. I don't know why. That's just what the research shows, and that's what my clinical experience shows as well. People with lots of stress, people who clench, people who are usually, what's the word for it? They're organized, they're neat, they are, a lot of times they can be office type people who have a white collar job and they work really hard, or they're an admin, or they oversee a lot of people, they have a lot of responsibility, they take their jobs very seriously. Those sorts of people tend to have a lot of jaw symptoms. So we've been treating this for quite a few years now. My old boss, Dr. Shirley, used to treat it, and I learned about it a little bit in school and then learned a lot more when I came here. And so we take a bit of a unique approach to it. So there's a couple different things that we do, but the most important thing is first we have to figure out what is the problem. What kind of jaw problem do you have? Loosely speaking, we can divide you into a joint problem or a muscle problem. Okay, a joint problem is when the joint itself is the issue. The disc is the issue. You've got joint degeneration. You can have joint degeneration in the jaw, or you could have had something traumatic happen, right? You got hit in the face with a basketball, seen that. Hit in the face with a bat, seen that. I've unfortunately seen assault a couple times, a couple crime victims. And so that would be more of a traumatic sort of event. Most commonly, we're going to see the other hand, which is the muscular sort of jaw problem, where people don't have a crazy amount of motion loss. They can open the jaw most of the way, but what they struggle with is a lot of pain and tightness in the cheeks. They'll often have a lot of pain in the temples. They might have pain right in front of the ear. This is where the joint is. It might be really tender there. They might get a lot of headaches. Those people usually have a myofascial or muscular-based TMJ problem. So the typical treatment, again, it depends a little bit, well, quite a bit, on what sort of problem we have. But most of the time, we're going to include at least a couple of the following. One, we'll do intraoral massage. So that's where we use a pair of gloves, clean ones, and we actually take an index finger and we go in to the jaw, okay, and we work out the muscles. This can be extremely helpful. It can be a little tender for sure, but we're nice and it can relieve a lot of tension and pressure. Coupled with that, we might do a lot of external massage as well, where we're working through the cheek, underneath the chin, okay? We might focus on these glossal muscles here, these tongue muscles. We might even focus a little bit here. We'll certainly do massage work and trigger point work to the neck, the back of the neck, because of how intimately this is linked to the jaw. So the neck, obviously this is one unit. We don't want to think of things as separate parts. The jaw and the neck, the movement is orchestrated together. It's wired together, and things that are wired together fire together. Okay, so with that, we'd also do manipulation to the neck, most likely, checking the cervical spine, making sure that things are functioning there, that we have the amount of motion that we need, especially where the skull articulates with the first cervical vertebra. Okay, we also might talk a lot about, we will talk a lot about prevention. So if you're a high stress person, we're going to talk a lot about clenching, how to avoid clenching, good behaviors, bad behaviors, and how to change those. That can take a lot of time. And so usually that's the crux of our treatment, though, is you need to be able to stop the thing that's hurting your jaw. And all the things that we do are supporting you as you stop hurting yourself. With this, we usually start off with a couple weeks of treatment, and we see how patients progress. If at any time we suspect there might be something else going on, we'll refer back to your dentist or maybe to an oral surgeon. We work with a couple different oral surgeons, and we can coordinate care as needed if it's a more advanced or more complicated case. And that does happen sometimes. In general, most oral surgeons are not going to want to take a surgery first approach to the jaw. And so usually we see them first, and if they're intractable, they don't get better, we might refer to an oral surgeon. If we think it's an orthodontic problem, we might refer back to the dentist or an orthodontist, and so forth. So those are some things those are the approaches that we take. We find that we get really good results with this. At some other point, we'll probably do a video on some of the more complicated problems that you can see with the jaw, because those do pop up, especially dislocations of the disc. Hope this helps. Hope this is interesting. Thanks.